So guys, disc problems and facet joint problems. These are two lower back issues which are talked about all the time. But how do we tell the difference between the two? Let's find out. Hey guys, Khalid here. Welcome back to Clinical Physio. So the first place to start is our 3D anatomy model. So I thought I'd start this off by actually introducing you to what are discs and what are facet joints. So let's get into it. So first of all, let's talk about intervertebral discs. These are present throughout the spine, and their main aim is to create a cushioning between one vertebra and another. So their role is in shock absorption, and as you can see, they are soft tissue fibrocartilaginous structures. Now they are filled with an element of fluid, which means that they can change shape ever so slightly, and it really is slightly. And this is actually really useful because it means that when we move, the discs move as well, and that allows them to spread the load through the spine. Now facet joints are slightly different. We can see these here at the back or the posterior aspect of the spine. Here you can see the facet joints on the left side at the T8, T9, T910 and T1011 levels. And of course, for every facet joint that we have on the left side, we also have one on the right side as well. And effectively, these structures create a joint between one vertebra and the next. So if we focus in here on the T8 vertebra, and here we have the T9 vertebra, and here is the left-sided facet joint between the two. And of course, as we said, we have one on the right side as well. Now, one really important feature of facet joints is that they create a little bit of a gap or opening between the different levels of the spine. And these are called the neural foramen or the neural foramina if you're talking plural. And effectively, this small gap, as you can see, is where a spinal nerve will run through before it exits the spine. And that means that if there's a problem with the facet joint, it can impact on that little gap and therefore the nerve as well. Now, as you will see from the video on the screen, different movements of the lower back do different things to these structures. When we extend the lumbar spine or lean backwards, we actually close down the facet joints, as you can see here. Whereas when we flex the lumbar spine or bend forwards, we open up these facet joints. However, the textbook suggestion is that more pressure is put on the intervertebral discs during lumbar spine flexion, and that the discs may be pushed a little further backwards or posteriorly during flexion towards where the nerve tissue is. Therefore, the textbook suggestion is that lumbar spine extension may aggravate the facet joint problems because it closes them down, but that extension may ease disc-related issues. On the other hand, the textbook suggestion is that lumbar spine flexion may aggravate disc issues, but may actually ease facet joint issues because, as we can see, the facet joints open up during this position. So sometimes we might look at our patient's presentation, and if it's really clear and obvious, we could potentially link those movement differences to the structures we've been talking about. So for example, if your patient's symptoms are worse in flexion but better in extension, might that tell you that it's a disc-related problem? On the other hand, if their movement is worse in extension but better in flexion, might that tell you that they have a facet joint problem? This isn't the case all the time, but if it's really clear and obvious, it might give us a little bit of insight. So what about when your patient has nerve-based pathologies? Well, both of these issues, disc-related and facet joint issues, may or may not cause nerve symptoms for our patients. For example, if the disc material does compress the nerve tissue here at the back of the vertebra, it could create nerve-based symptoms, and sometimes we see that with a disc protrusion or a herniated disc. Also, therefore, if we look at the facet joints, if the facet joint is sufficiently irritated, or as we get older, sometimes around the facet joints we develop osteophytes as a part of the growing and aging process, then as you can see, these also may impact and compress on the nerve, causing nerve issues. And therefore, if our patients do have nerve issues, we really must keep an eye on them and screen them with things like myotomal tests and dermatomal tests to see if we need to refer these patients on to an appropriate specialist. So let me give you some quick ideas on how we might manage these two issues in practice. Well, if we think about the anatomy, we talked about disc may be worse in flexion, better in extension, and therefore you may find that if you follow the Mackenzie school of thought, some lumbar spine extension exercises can be useful for disc-related problems. On the other hand, when we thought of the anatomy with the facet joints, we saw that these were worse in extension but better in flexion because flexion opened up those facet joints, and so you may consider some flexion-based exercises for your individuals who you think have a facet joint related problem. And ultimately, two super important points for any patient who has low back pain. We know that reassurance always has a really big impact for these individuals. So always take the time to explain, educate things through with your patient and reassure them that things absolutely can get better even if they have those nerve-based symptoms. And furthermore, we also know that exercises need to be meaningful for patients, and evidence actually shows that whether or not they have specific physio exercises or whether we just get them to move a little bit more, whether that be going for a walk, whether that be cycling, whether that be swimming, whatever is meaningful and perhaps more importantly comfortable for the patient may well be a good idea for their rehab. So guys, I really hope you've enjoyed this video. If you have, please support us by smashing that like button, subscribe to the channel for all our best updates, and remember, there's loads more from us on our Instagram channel @ClinicalPhysio and on our website, clinicalphysio.com. I'm Khalid, thank you so much for watching, see you soon here on Clinical Physio.